to see improvement. So we want to measure that improvement with time to say, okay, within this time frame, we want to see this patient do XYZ. So for impaired gas exchange, when we know this patient is having difficulty getting oxygen perfused into his body, our biggest concern is that this patient is not getting enough oxygen, his organs, his brain, and that's another thing that could also cause confusion because he's not getting enough oxygen. His O2 sats are really low. So all of those things combined, we want that to improve. So our outcome for that patient, our hope and our wish for this patient is that he will show improved oxygenation by normal blood gas levels, and I say immediately, because this is not something that we want to put off into the future. We don't want to say, oh, we want to see this patient improve O2 sats by discharge. This patient needs oxygen now. Our bodies need oxygen immediately. Without it, we die. So we want to see this patient have immediate change by our interventions. We raise the bed, we apply the oxygen, we're checking his O2 sats continuously, monitoring it with continuous O2 sat monitor. We're on it. We're making sure this patient is getting as much oxygen as we are allowed to give him, and we want to see improvement. If the patient is able to take any deep breaths, cough, clear something from the lungs, anything to move things, to make room for oxygen to get in, we're going to do that. We want this patient to be oxygenated. So that's why we want him to show improved oxygenation immediately. Now, moving on to the ineffective self-health management. Self-health management. It's not easy to say. So, because this patient says that he hasn't been to the doctor in years, our goal is for him to start communicating with his doctor. So we want him to collaborate with his healthcare professional, whether it's his doctor, nurse practitioner, or a PA. We want this patient to start communicating, and we want him to get on a health regimen that is appropriate. So whatever it may be, whether it's working on smoking cessation, whether it is working on his nutrition, whether it's working on, improved lung function, medication, whatever it is going on, we want him communicating with his doctor, working with the doctor, and being able to keep that up in a routine fashion. Our next one is for the risk for acute confusion. So we want this patient to maintain functional mental capacity. We want this patient to be able to function as well as he physically can. Because again, further assessment is needed to really find out why this patient has confusion. Is it just because of the infection and the O2 saturation? Or are there other underlying conditions that's causing the confusion? So the goal is for this patient to maintain functional capacity. We don't want him to go down. We would like for him to improve, but we can't predict that. With low oxygenation, we don't know what damage is being caused. We don't know if the underlying conditions can cause, the issue. So we want to do whatever we possibly can to find out why this confusion is happening and what ways we can work with the physician, or what ways we can use interventions to slow down or stop the progression of the confusion. And then with imbalanced nutrition, less than body requirements, our outcome is for this patient to weigh within normal range for height and age. And that's kind of a ongoing thing, because we can't necessarily assume that this patient being hospitalized is going to get to a normal weight while he's in the hospital. So we can't really say within so many hours or so many days. This is going to be something that's going to take time. It's going to take him collaborating with his doctor So the goal is that we are setting this patient up for weighing within normal range. So we're getting him the help that he needs. We're assessing and monitoring for any other signs like malnutrition. We're discussing with the patient any issues that he has with food or any other issues, maybe like we said, depression or changes in diet like veganism or vegetarianism or something. Those type of things we want to have discussed with the patient and make sure that we got him the proper teaching regarding that specific area so that he can be on the path to weighing a normal weight for his age and height. So that was a basic concept map. We just used 4 diagnoses. There are many more diagnoses that could go with this patient because this patient has other issues. And as we assess, the more we assess, the more we're able to come up with diagnosis, because the diagnosis, unlike the doctor's diagnosis, our diagnosis is for the immediate problems that we see that is a result of the medical diagnosis. So that medical diagnosis, whatever it may be, whether it's heart failure, some respiratory issue, burns, cancer, uh, spinal cord injury, whatever the issue is with the patient, that medical diagnosis is what spawns our nursing diagnoses, where we look at all the areas that are affecting the patient negatively because of this medical diagnosis and what we need to do to help the patient reach optimal health. Maybe not perfect health, maybe not completely restored health. That is our wish and prayer. But for what we can do medically, we want to have our plan in place to be able to have focus on these areas. The patient has pneumonia, impaired gas exchange. That is an area that we need to address. Confusion, that is an area we need to address. These are all affected, caused by some issues with his health. The ineffective self-health management, which could have led to him developing the pneumonia. And also that nutrition, which also is a negative for him having pneumonia because he needs adequate nutrition for his body to be able to heal and recover. So all of these things are extremely important. They are pertinent to his medical diagnosis. And this is why it's important for us as nurses to do accurate assessments. And having a concept map is a very simple, easy way to have the whole picture, our whole picture of what we need to do for our patient, and also to be able to communicate it to other nurses and to other staff members, and that in that way they can see what we're doing and what areas may need to be